And also, you are required to go to the Department of Consumer and Regulatory Affairs because you will need to get permits anytime you're going to add something on to your house. The government wants to make sure that the adequate permits are issued and that people who are qualified to make these upgrades are used, that somebody is not going to build a stair lift or a chair lift and you get injured because they didn't know what they were doing. So that's why that there is a process, but if you follow the process, and that's part of your case manager's responsibility, is to help you with that process. And then the third component of the home modification piece includes the putting in a bathroom or improving the one that you already have. We're going to take a short break right now, and I will be back and we will talk more about how to get the most from your Medicaid waiver home health services. We'll see you in a few minutes. Hi, and welcome back to the Case Manager Show. I was told that I may have confused you a little bit about income requirements for the Medicaid waiver program. So just let me go back over that to make sure that we're all clear on what the income requirements are. For a single individual, income can be no more than $2,022 per month gross. That means before taxes are deducted. And for a husband and wife team who both require services at the same time, the income can be no more than $3,033 a month gross. If only one person in a married couple requires care, then we only rate the income on the person requiring the care. The remaining spouse's income is not included or considered. There is a very important agency that is associated with the Medicaid waiver program. And you have some real good people over there who work very hard to see that you get your Medicaid waiver services. And they work very hard to see that at the end of the year, the Medicaid waiver recipients are recertified annually. On the anniversary of your approval date, the following year, you are required to recertify for your Medicaid. And it's the home health agency's responsibility to ensure that you are recertified in a timely manner so that your Medicaid does not expire. And this agency that makes sure that all of this is put together is called the Department of Health Care Finance. And they are formally the Medical Assistance Administration, and they are responsible for administering the provision of public health insurance in the District of Columbia. Programs administered by the Department of Healthcare Finance, we all in the business say DHCF for Department of Healthcare Finance. The programs include Medicaid and Medicaid waiver oversight, the Children's Health Insurance Program, or CHIP, and the DC Healthcare Alliance for people for whom their income is more than would qualify for Medicaid waiver, but not enough to afford basic insurance, or what they would call, I can't think of the word now, market rate insurance. And the Department of Healthcare Finance covers 1 in 3 DC residents. So that's a whole lot of people for whom they are responsible for ensuring health care. Now we're going to talk about some scenarios. If sometimes I get calls from people who want to know, well, this has happened to me, or my hours have been cut. The home health agency cut my hours, and my doctor said that I require 12 hours, and the agency is telling me that I can only have 8 hours. What do I do about that? Well, you have a right to disagree with anything that the home health agency or the government, for that matter, tells you, and we cannot just arbitrarily make changes to your health care plan if you don't agree with it. First of all, you must have due process. There is a system here. The agency must first of all give you a 30-day notice of its intent to change anything. And if you don't agree with the agency or the government's decision, you have the right to request a fair hearing. And fair hearings are submitted to the Healthcare Ombudsman's office, and that number is 202-724-7491. That's 202-724-7491. If you disagree with something or a decision about your healthcare services, you call up the ombudsman's office and let them know that you disagree with this and you want a fair hearing. They will arrange the fair hearing for you. Or you can just dial 311. That's the mayor's answer call system. Tell the operator you wish to be connected to the Office of Fair Hearings or Administrative Hearings, and then you can arrange your own fair hearing. It's a 2 to 3 week process, and that's where you will get a chance to go in with any medical documentation that you might have, or a letter with your doctor, from your doctor, if it's about your home health hours, or any documentation you feel would support your position, and to show the arbitrator that you do not agree with the decision and why you don't agree with it. That's your right as a Medicaid waiver recipient. Always remember that no one can just arbitrarily change your services that we have agreed upon from the day that the case manager came into your home and did that assessment. You signed, the case manager signed off on the individual service plan. That service plan was created exactly for you, and there is a process before it can be changed, and that you do have the right to go to a fair hearing. We are going to prepare to go to a break, and when we come back, we will talk more about what you can do in some situations that may be troublesome to you. And we'll even talk about what you do if you have a wonderful home health aide and you want people to know how great your services are. The Ombudsman's office takes complaints, but they also like to hear the success stories, and they want to hear about agencies who are doing good work. And there are a lot of agencies and a lot of people who are so devoted to providing personal health care. I happen to be one of them, and there are many, many, many more people like me who enjoy what we do. We love our work. We love taking good care of our seniors and our people with disabilities and our people with chronic illnesses. It's so important to me and the work that I do, which is the reason and the rationale behind this show. We want to get the information out to you. And as they say, information is power. We want to empower you with this information. This concludes today's segment of how to get the most from your Medicaid waiver home health services. I have so much enjoyed being with you today in your living rooms and around the city, and I look forward to bringing you more information to empower you and to ensure that you get the most from your home health services. I will see you next time. This is Shirley Tabb saying, stay safe out there.